Welcome to the sixth in our series of COVID-19 podcasts. The topic of this podcast is what life is like living and working in a pandemic world. I'm delighted to be joined by the chair of our scientific panel, Dr. Nicholas Davies. I've known Nick for many years. In fact, I was trying to work out, Nick, how many years. I can't remember, but I'm guessing it must be around 20 years. So Nick was one of our very first professional members of the Encephalitis Society, and also during the 90s he served as one of our board of trustees. He's a consultant neurologist at Chelsea and Westminster, Charing Cross and the Royal Marsden Hospitals in London, and has been working on the front line during the COVID-19 crisis. So Nick, we last saw each other in January. We had a glass of wine. We were talking about our forthcoming conference. We were happily ensconced in the Royal Society of Medicine, but little did we know that the next time that we were going to meet was going to be on a Zoom call in the middle of this pandemic. So how are you?
I'm well, thank you. I've survived physically. I fortunately was probably out of the country as the epidemic was really getting going in West London after the half term in February. So by the time I was back in circulation, I was ready to take appropriate measures.
So how have the past 4 months been for you and for your colleagues?
Very, very peculiar. West London was particularly badly hit early on by the COVID pandemic. Chelsea was very badly affected as people returned from skiing holidays. But in my part of London, the borough that's most badly been hit is Brent in northwest London, that has had sadly the highest mortality of any borough in the UK. So it's been very different. Our working patterns have had to change very radically, very quickly. Our contact with patients as outpatients has changed to being a telephone and perhaps in future video-based service for much of what we do. Our inpatient working load changed dramatically, and we saw the neurological consequences of COVID infection. It's been a very challenging time. It's been a very exciting time in some respects as well. Hopefully this is a once in a career event to see a new disease present itself, to learn about it, and taking a step back, it's been professionally very interesting to see how our approach to this disease has changed over the 3 to 4 months. Even within the first few weeks, attending our intensive care units and seeing how their approach to patients changed week by week as a better understanding of the disease became apparent, was absolutely fascinating. And of course, it's been amazing to be a very, very small part of this enormous national, multifaceted team that's pulled together to try to give the best healthcare we can to as many people as possible.
Do you think, that I'd be right in saying, is this the biggest challenge that you faced in your career?
Oh, without a doubt. I mean, could you imagine? Actually, I think we caught up at the start of March. I can't remember if that was in person or remotely. And I was discussing you then before the lockdown. I was discussing with you the potential changes we were going to put in place in our hospitals in the next few days, and discussed with you then the initial Imperial College epidemiology planning of what this was going to affect and how there may be further peaks throughout the year. And what we were aiming for was to limit the height of the peak. And I think you'll remember then, I think, being almost as taken aback as I had been a few days earlier when I'd first seen the data as to what was going to unfold. And actually all of those predictions so far have been relatively accurate.
Yeah, I do remember it. I think we were probably on a Zoom call or something, maybe. You talked a little bit earlier about the area that you've been working in having a high mortality rate, and I just wondered why you felt that was in your area, and perhaps hindsight's a great thing, but could we have learnt more from the original SARS outbreak that we had a few years ago?
So I think there are always lessons to be learned, and I'm sure in due course we'll look back at how we dealt with things in the UK and try to make try to look for ways to make things better if we're faced with a similar situation in the future. But I think over many years, infectious diseases and communicable diseases have gone to the bottom of the pile. The focus has been on treating cancer, improving cancer outcomes, improving stroke and heart attack outcomes, improving management of diabetes and of hypertension. And infectious diseases have been at the bottom of the pile. And we've forgotten many of the lessons of old as to how to prevent infectious diseases. And I think that's something as not just within medical and nursing environments, but also with us and the way we live our lives. And I think it's been a big wake-up call on many fronts.
Mm. What's your day-to-day working life like at the moment? We know that we're over this initial major peak. So what's day-to-day like for you at the moment, and what precautions are you having to take?
So as of a fortnight ago, we got back to working in a similar way to how we had done prior to COVID. So I work at 3 different hospitals. 2 of those hospitals I do clinics at. Those clinics are still predominantly telephone-based clinics at present, although we're well aware that patients with neurological problems in particular need to be seen physically, and we're making arrangements in order to be able to do that. Within the hospital environment, things have changed significantly in the last week or so. We're now expected to wear masks most of the time, certainly where we're in the vicinity of other people. And you can see in this office at the moment, I'm here by myself, and that's why I don't have to wear one of these. So that's something very different. We're still taking great care with patients, and we are not wearing the full FFP outfits unless dealing with patients with COVID or suspected COVID, but we're still taking much more care than perhaps would have been the case 6 months ago.
Clap for Carers has got a lot of attention, and rightly so. Has it been well received by yourself and your colleagues?
Yeah, I think it was much appreciated. I think many in the medical profession, they felt that this is a massive effort, and lots of people were needed in many different walks and environments to make what was a national effort work. So I think many of us feel, a little embarrassed to be in the limelight. Certainly, just within medicine, my part was helpful, I hope, but I wasn't one of those people working 12-hour shifts in an intensive care unit with the tight-fitting masks, the sweaty suits, all the rest of it. They have been real heroes. And also looking around our hospital and the transformation that happened early in the epidemic, it required huge efforts from everybody. The estates department managed to open a second ICU. We doubled our intensive care capacity very quickly. Wards were converted almost overnight into single rooms from multiple occupancy bays. More oxygen was plumbed into the hospital, more electricity. The army turned up to keep the deliveries of FFP coming in. Our cleaners have worked 24/7 to try and make the place spotless. We've had a host of volunteers with their purple t-shirts on, helping to keep the show on the road. It's been a real national effort, and certainly in London, early on, the population made a huge effort to socially isolate, to distance, and without that effort on every front, I'm sure things would have been very different to what actually happened at the peak in April.
Yes, I think you're right, and I think it's really important that we remember everybody that is behind the scenes that contribute to, as you say, what was this incredible national and around the world international effort that went on. You talked about peaks just then as you finished, and I wondered, do you think it's inevitable that we're going to be facing peaks and troughs as varying numbers of people become ill? What does that look like?
I don't know. And I should say, first and foremost, I'm a neurologist, not an infectious diseases epidemiologist. But I think the one thing I'd say is that models are based on looking at other diseases that we know more about and trying to bring data from that and put it on to extrapolate and to put it on to this new disease that we face. But we're constantly learning about this virus. We don't know fully the environmental factors that that cause its transmission. I don't think fully understand why it disappears. We don't fully understand the immune response against this virus. For instance, now with antibody tests, we're finding people who definitely have had the infection with symptoms and the PCR test who don't have antibodies but are better. And there are people who've had no symptoms who seem to have antibodies. So there's so much more to answer. And therefore, I think we have to keep a really open mind, and we have to be cautious. And through our daily actions and interventions, I think we need to take the appropriate steps to try to ensure that further peaks don't occur. But what the factors are that might lead to a further peak, I think we've still yet to learn.
Yeah, no, very interesting. And I think you're absolutely right. It is a virus that's really keeping us guessing. A lot of it doesn't make sense, or at least to us, it doesn't make sense to us yet. Do you think, given that situation, do you think that we should be easing current restrictions as we are, or would you have liked to have seen stricter measures?
I think it's very much a political decision. And these measures that have been put in place have had massive impacts on many aspects of people's lives. For instance, in April, our economy contracted by 20%. Furloughing is going to stop, or rather employers are going to have to contribute to furloughing, I think, from August. Many people have already lost their jobs. School children before too long will have gone 6 months without formal education. These things have massive implications and need to be weighed up. And we need to find, as a nation, a way to navigate ourselves out of this. So I don't think that the answers to taking things further forwards are purely medical. But I think all of us as individuals will have to make personal decisions and through our own behaviours do our bit to try to minimise potential spread of infection.
Yeah, I mean, as you've alluded to there, it has taken a superhuman effort to cope with the pandemic so far. I think, both for people who have been working on the front line, but also, as you say, general members of the public that we were reliant upon to do their very best to help us stop the spread. Do you think that there's a point politically, economically, medically, that we could reach a breaking point, or do you think we're going to see this through successfully?
I think that as a country we will pull together and we will see this through successfully. I think there are going to be bumps along the way. I think that the measures needed to see it through have to be measures that people are prepared to abide with. And we are a nation that that does things collectively, and we are not a nation used to following draconian rules under threat. And I think that if we went down that route of a more police state, I think that we would see bigger problems, and it wouldn't work, and it would have a really negative impact on control of COVID. So I think things have to be done with the will of the people and the support of the people. And it's very, very difficult to balance up the impacts of the measures taken, both financially, personally, mental health, impact on a whole generation of young people's education. These things need to be very carefully considered.
Yeah, wise words indeed, and the anarchist inside me agrees wholeheartedly with you in terms of that approach. But let's just talk for a moment about some of the neurological complications that we've been seeing as a result of COVID-19. Could you tell us a little bit about that, and in particular any that you may have experienced?
So I've yet to experience any neurological side effects of COVID myself, but I think that's a good place to start, because many of my colleagues have had COVID, and headaches, slowing of thinking have been really, really common symptoms. And my colleagues who've been hit by COVID relatively severely have often found it's really taken them several weeks, not just to get their physical energy back, but to get their brain firing again on all 6 cylinders. But they have got through. So I think at the mild end of the spectrum, there are symptoms that we all know about. Loss of smell is being highlighted frequently, but headaches with fevers and flu-like symptoms have been common. In the people who've had more severe COVID disease, who've developed clotting disorders, so disorders where their blood clots excessively, and in those who have had excess inflammation in their blood, we've seen a number of things. We've seen patients having excessive strokes, so blood clots blocking off blood supply to the brain. We've seen evidence of inflammation affecting blood vessels and arteries in particular within the brain. And we've seen conditions where the immune system has appeared to attack the brain, causing brain inflammation, which in our society we all know what that is. That's encephalitis. The latter cases, thank goodness, have been relatively rare, but the stroke cases have been more frequent, but generally most severe in patients badly affected with lung disease. And then there's another aspect, which is what's happening to patients who have had COVID and are in the process of recovery. And there we are really, really in the early days of observing and seeing and listening. And it may be that we pick up more neurological problems there. Certainly, we've seen a few people who in recovery have had difficulties with what we call the peripheral nervous system, which is the nerves in the arms and the legs that have been injured either because of the inflammation from COVID or because of having been very, very unwell. So there are conditions like that. I suspect that we will see patients having fatigue and mild cognitive difficulties. We often see that after other viral infections, and I think there's no reason to believe that COVID is going to be any different. And then slightly more broadly, there's been some interest in what our psychiatry colleagues have seen, and our psychiatry colleagues have seen an excess of new onset psychological problems in young people who've had COVID. And again, we need to understand whether that's because of the infection itself or whether it's because of other factors associated with the infection. The psychological impact of lockdown, being deprived of other stimulation. We've got to learn.
I was listening to a webinar, Royal Society of Medicine webinar, actually a few weeks ago. And I don't know how this had passed me by, given how long I've been doing this, but I was really quite surprised when I heard it was an intensive care specialist who was talking, and he was saying that for some of these patients who've been very, very poorly and they've been in intensive care, the potential for them during their recovery to be suffering from post-traumatic stress disorder or PTSD. I hadn't realised that was a thing. He said something along the lines of there's 20 definitions of torture by the Geneva Convention or one of those things, and he said, and we do every one of them in ICU in intensive care, and I was really taken aback by that. And I guess that's something I guess I want us to make a bit more noise about, because I wonder if some of those patients, very much like our encephalitis patients, when they leave hospital, no one's told them that brain injury is a thing after it. And I wonder if anybody talks to these patients about the risk of PTSD afterwards, and whether people go home wondering what on earth is wrong with them, why they're suffering in this way.
I think that's a really valid point. I know many intensive cares, and certainly the ones run at St Mary's, Charing Cross and the Hammersmith hospitals, have a follow-up service, which initially is by telephone, for the physical and mental aspects of having been critically ill. And I think it's really important. I think one of the things about PTSD is actually it often comes to manifest after the physical recovery has happened. It's as if only then, does the mind have the opportunity to focus on these things. And I with our encephalitis patients, frequently see this, and I sometimes use the analogy of a soldier returning from a war zone. It's actually as you begin to decompress after the physical impact of what's gone on, that the psychological impact takes hold. And I think I often use a discussion about sleep as being a really useful way to open up about some of these things that may be going on, because disturbances in sleep can often be an early sign that something's amiss. What I'd say to people is, talk. And if you're having difficulties finding somebody to talk to or somebody to listen, then the NHS has this great self-referral service through IAPT. You can look up NHS IAPT on Google, put in your postcode, and find a whole series of talk-based resources that you can refer yourself to without the intervention of a healthcare worker. So amongst individuals who've been through tough experiences in hospital, yeah, be aware. But also, think about the relatives as well. I can only think, how difficult it must have been during this period as a relative to have had a loved one critically ill in hospital that you're unable to visit. You may be shown their face on ICU through, through an iPad or something a couple of times a week. Have little understanding of what's going on. Medical and nursing staff who similarly are learning and not able to give you definitives as to what's going to happen, what they're expecting. I don't think the PTSD will just be seen amongst survivors of COVID. I think it will be equally, we will see it in next of kin as well.
No, that's a really important point, and thank you for bringing that up. I think, again, along with the cleaners and all the other people that can easily be forgotten during this pandemic, I think you're absolutely right. I think the carers can be easily overlooked as well. So we're coming towards the end of our podcast, and I wondered, do you have any advice for members of the public who are listening to you at the moment?
So I think we need to begin to try and get our lives back to normal. And I think there is I think amongst a proportion of people, there's a huge fear about this illness, and that's understandable. But we do need to get on again. We do need people to start getting, back on with their regular assessments, their regular activities, and on the medical side, we need people in due course to get on and have their regular cancer screenings. We need people to let their GPs know if they've got new symptoms that need to be checked out, new lumps and bumps. We don't want people to be missing out on healthcare through a fear of engaging with healthcare workers. We in hospitals, and is the case in primary care, will do our absolute best to make sure that if you have to come to a healthcare facility, you're not going to pick up an infection from us. And that's at the forefront of our minds. And we're really trying. And it's, I think, very important now that we try to get back to some form of normality. It's going to take time. There are going to be hiccups, but we want people to be getting treatment for their other ailments and investigations for new symptoms. And that's really important too.
Yeah. My final question to you is, do you think that anything good or anything positive can come out of this experience that we've all been through?
Of course. We've learned masses. We have, I think, in many respects, pulled together as a society, which is a good thing. I think that actually many of us have been deprived of lots of experiences or bits and pieces over the last few months, and actually life can go on without going to restaurants every week or living the high life. Obviously we want some of these things back in our life, but I think it's made us focus on the things that are really important, and it's made us think about the people around us, which I think is an important thing to do as well. And people around us who are not necessarily our family and friends, but our neighbours, the people we meet in the street, and the people that keep the world going.
Yeah, no, wise words indeed, and I think that's absolutely right. Before I do my closing remarks, is there anything else that you'd like to say, or is there anything that I haven't asked you that you'd like to comment on?
I think the Encephalitis Society's done a really good job at trying to keep people informed, trying to keep on top of a changing medical world, and being engaged with all that's happening at light speed, it seems, research-wise and information-wise. So many thanks to all who work in the Encephalitis Society for keeping the show on the road during these difficult times and with their home working, and for being so engaged. It's hugely appreciated.
Oh, thank you, Nick. The team will be made up when they hear that. I know they've all been incredible, and I couldn't be a more proud CEO than I am of them. They've all really stepped up and gone beyond, and they always did that before. But yeah, I've been proud to work with them. Well, look, we're deeply grateful to you for taking the time out to speak to us during this, extraordinary time, and one of these unprecedented, I think it's a word that's been overused probably over the last few months, but unprecedented time in your career. On behalf of all of our members and everybody at the Encephalitis Society, thank you for all that you do. Thank you so much for having been there for us during the last 20 years. It's so important. All of our scientific advisors, you're all volunteers. You will give your name to us. You give us your time, all free, and we're deeply grateful for that. And we wouldn't be where we are or able to do what we do without all of your care and guidance, that we've had over the last few years and that we get at the moment. But we also want to take this opportunity as well to reassure any viewers that, as Nick said, the Encephalitis Society services remain unchanged and unaffected during this difficult time. So if anybody needs any support or information, our teams are still at your service. Go to encephalitis.info for contact details or just to chat online. If you've enjoyed this podcast or any of the ones that preceded it or come after it, and you can support our work, then please visit encephalitis.info/donate. But most of all, wash your hands and stay safe.